So thanks everyone for joining to our lunch and learn session today on the Deep Engagement Partners. I'm Lauren Webster. I'm a senior officer within the communities team at BCC Public Health. So the session today is just going to go over the background to the Deep Engagement Partner Programme, what the programme actually is, and sort of what we're looking at achieving with this over the next 3 years. So some housekeeping. So please stay muted and turn off any VPNs. If you have any questions, please pop it into the chat and we can answer them as we go, but there will be a Q&A session at the end. You'll also get these slides via email and that will be accessibility checked, so you can have a read through of them. And of course, the webinar is being recorded, so that'll be going up onto the Healthy Brum YouTube channel, so you can have a read through afterwards. So a good place to start with sort of the deep engagement partner work is looking into sort of the role of public health and the role that communities play within that. So just a short overview of sort of Birmingham's communities. Birmingham's known as a super diverse city, which means that it's made up of over 100 nationalities. Our 2021 census showed that over 50% of our city is non-white British, with the top 3 ethnicities being our South Asian communities, our largest one being the Pakistani community. Birmingham is also one of the youngest cities in the UK, with the median age in the 2021 census being just 34 years old. And we do have a slightly ageing population, so in the 10 years between the 2011 and the 2021 census, we saw increases in the population in sort of the over 50s age bracket, but a decrease in those aged 4 years and below. So just a short overview of public health in case anyone's new to it. So it's described by the Faculty of Public Health as a science and an art of preventing disease, prolonging life and promoting health through the organised efforts of society. Public health has been under the role of local authorities since 2013, and it's funded by OHID, with local authority teams reporting to health and wellbeing boards who set out our strategies. For example, we work to the 2022 to 2030 strategy within Birmingham. And within public health, we have 3 core components. So health improvement, contributing to increased life expectancy and healthier lifestyles, and reducing inequalities in health and addressing the wider social determinants of this. Health protection, which I think most people are familiar with public health, sort of looking back at COVID. So protection from infectious diseases, environmental hazards, and emergency preparedness. And finding health services, so assisting those who plan healthcare to understand the health profile and health needs of the local population, and helping with planning of these services to meet population needs. The role of communities within public health, there is a wide range of benefits with working with community organisations and community groups. So in Birmingham, we aim to work closely with our communities, and in 2020, the communities team was set up based on learnings from the first wave of COVID. Some of the key benefits of working with communities include sort of advising public health on how to better design services for their community, and communities can often help reach seldom-heard voices, so that we can better understand their needs. And then one of the key parts is that local communities have a passion for addressing their own health and well-being and can often be the most influential in implementing health. And by working with our community organisations, it means that we put community voice at the core of public health interventions to better help our citizens.
I found out eventually.
So when we discuss about working with communities, there are 3 sort of ways that we describe communities. So communities of place, communities of identity, and communities of experience. And we're sort of stepping away from homogenising the term because we realise that all these different community groups have different needs. When we sort of discuss communities in regards to the Deep Engagement Partner Programme, we're primarily talking about communities' identity. So looking at communities based on sort of gender, ethnicity, sexual orientation, age, faith or belief, and disability. But the other 2 types of communities are communities of place. So inequalities within Birmingham, can be from different geographies and different cities. So there's differences between the inequalities in Birmingham in comparison to inequalities in Sandwell. And finally, communities of experience. So experiences that might include veterans, care leavers, homelessness, and substance misuse. But for today's session, when we're discussing communities, it's broadly communities of identity. So I'm very aware that this session is going to be a lot of me talking to you. So we thought we'd sort of try and jazz it up and make it a bit more interactive. So we've got a short quiz on sort of the communities of Birmingham, just to sort of highlight the variability within our communities. So if you guys want to put your answers in the chat, that would be great. So the first question that we have is, how many languages and dialects are spoken within India? So 1, 250, 2, 1,750, 3, 10,920, or 4, 19,500. So we've got a couple of answers already. So I'll give you a little bit longer. Okay, so our answer for that one, we only had one person right in the chat, so that's 19,500 languages. So languages or dialects spoken within the country. So Hindi is the primary language spoken by 615 million people within India, with Bengali being the second most common, followed by Urdu. So question 2. What date is Carnival usually celebrated within the Caribbean? So 1, Good Friday, 2, Ash Wednesday, 3, Summer Solstice, or 4, Maundy Thursday. So everyone's going with 3, I think. Guys, you gotta get better at this. 2, Ash Wednesday, or the days leading up to Lent. It's it's celebrated in most Caribbean islands for Carnival. A lot of you thinking about the one in August, so sort of Notting Hill Carnival. That's linked to mainly a celebration linked to sugarcane. I think it's Jamaica linked to that celebration, but most areas in the Caribbean celebrate it on Ash Wednesday, which is coming up soon. So question 3, what are the 2 most popular forms of physical activity taken up by the deaf and hearing loss community? So you've got 2 answers to pick from with this. So 1, walking, 2, running, 3, gardening, 4, fishing, and 5, golf. So we've got a couple coming in now. Okay, some of you have got better with this one. So it's 1 and 3, walking and gardening, are the chosen activities most individuals with hearing loss take up for physical activity. So you guys are getting better. Okay, so how many human gurus have there been in the Sikh religion? So 1, 5 gurus, 2, 6, 3, 10, or 4, 11. If any of you been doing your culture intelligence journey at BCC on the Sikh religion, I'm hoping we're going to get a couple of right answers. Okay. So you guys smashed that one. So there's been 10 human gurus within the Sikh religion. So the final human guru, Guru Gobind Singh, transferred the spirit of the eternal guru to the sacred scripture of Sikhism, the Guru Granth Sahib. So there we go. And then our final question, a bit more local. So from the 2021 census, which area of Birmingham has the largest community of bisexual people? So 1, Kings Heath, 2, Selly Oak, 3, Digbeth, or 4, Edgbaston South and University. So we've got a mix of answers for this one, I think. Okay. So it was Selly Oak. So if you're thinking about it geographically, we have a lot of students in Selly Oak. And we see with our bisexual community, it tends to be a younger profile. So had the largest community in Birmingham with the 2021 census at 7.1%. And then the second highest population was Edgbaston South and University. So thanks for taking part in the quiz. It's now me talking for a bit, so here's all the useful information. So before we sort of get into the deep engagement partner work, it's sort of important to look back at the previous engagement work that got us to this stage. So one of the first key projects within the communities team when it was set up was the community health profiles, and that's acted as a key evidence base for us. So they're evidence summaries focusing on specific communities of interest, and they provide an insight of the health inequalities, so health need within the target community. And there's thematic areas throughout the report. So that includes getting the best start in life, mental wellness and balance, healthy and affordable food, active at every stage, working and learning well, protect and detect, aging well and dying well, and contributing to a green and sustainable future. And all these areas were taken from our health and wellbeing strategy, with each topic then being subdivided into further themes. So with protect and detect, we go into screening, vaccination, COVID-19, oral health. And then for more information within that, we have links in the chat, I think, for the health profiles. So we have 25 communities of ethnicity, faith, disability, sexual orientation, gender identity. And we also have some webinars on that. If you're doing any sort of key work within communities in Birmingham, this is a really great place to start to have an overview of the health profile within that. And then from the health profiles, we had our engagement partners. So these partners were on for 12-month pilot projects, and they disseminated the profile findings, and they had mini projects focusing on 3 key areas. For this round of engagement partners, we had Caribbean, Bangladeshi, Nigerian, Somali, and Pakistani, and Indian. With our Pakistani and Indian partners, we had a slightly different approach where we commissioned multiple smaller contracts that was topic specific, so media outlets, women's reproductive health, and diabetes. And then we had with our LGBTQ partners, and we did focus on the lesbian and the trans community. With religion and faith, we had the Muslim and the Sikh communities. And then with communities of disability, we looked at deaf and hearing loss and sight loss. We also had our Black Ear engagement partners. For anyone that isn't familiar with the Black Ear Review, it's the Birmingham and Lewisham African and Caribbean Health Inequalities Review. So that review identified 7 key priority areas and 39 specific opportunities for action for improving health inequalities within these communities. So the engagement partners, all of their work was based on findings from this review. So they promoted and disseminated the review, and they supported in embedding recommendations from the review. And these projects ran between 2022 and 2024. We had 3 partners with this. So for our African communities, we worked with Allies Network. For the Caribbean community, we worked with Black Heritage Support Service. And then with the African and Caribbean young people, we worked with Mind's Eye Development. So what were the key learnings that we took from these projects? So they sort of split into 3 key themes, so community involvement, building relationships, and community capacity. Under community involvement, we learned that we should include community voices in street decisions, having community control over identified project themes, and being able to create a pipeline of community voices. With building relationships, it was acknowledging and considering power dynamics, providing opportunities for engagement with the council and the ICS, that's the integrated care system, our NHS sort of systems in Birmingham, and shifting the relationship to true partnership rather than just commissioner and partner through the work. And then finally, on community capacity, we wanted to provide organisations with resources and development, strengthening communities to build on their ability to implement local solutions, and then providing longer term engagement opportunities. So how have we evolved sort of programme engagement? For example, looking at community capacity with the Deep Engagement Partner Programme, we're providing community leadership training and then academic support for measuring outputs as evidence of success. So that provides organisations with resources and development. Looking at ensuring proportional reporting requirements, so revisiting reporting formats and requirements so that they're not a lengthy sort of report every quarter. We've sort of changed it so that it's more accessible and it's sort of easier to convey the same information, and co-creating reporting templates with the partners. And sort of the key one here is providing longer term engagement opportunities. It's great when we do a 12-month project, but then the work ends, and we want to sort of come away from that and work at sort of a longer term project. So that's why the project for the Deep Engagement Partners is now over 3 years. So you can sort of really develop the work that we're doing, and it's not sort of limited to a 12-month time span. So I've sort of given you a little bit of a hint as to what the programme is for the next 3 years. So we'll just dive right into it. So we've got 5 core objectives with our programme. We want to work with engagement partners to identify the local need, map community assets, co-produce solutions and create awareness of the solutions, and then evaluate the impact of these solutions. The 5 key areas are visibility, so increase the awareness on community experiences of health inequalities, health literacy, so improving this within the community, empowerment, so enhancing community capability for collective control of programmes to address health inequalities, and then policy change, so bringing the community in voice, including seldom heard voices, to strategy and policy development to address health inequalities more effectively. And then finally, improving health, so to utilise existing community strengths and capabilities to identify and produce solutions for the community's health and wellbeing. And how exactly are we doing that? So this is just an overview sort of our programme outputs. So these are for each year of the programme, so this will be repeated 3 times. So for each partner, we'll have 4 focus groups per year, including a qualitative summary report and dissemination of outcomes, public health engagement, so attendance of 5 council forums per year to disseminate public health messaging, and then 1 health inequality project per year, co-designed with the target community. And then training, so they'll be undergoing the community leadership training, developing 4 cultural intelligence training sessions per year, highlighting community researchers, and then overall just community upskilling. And I mentioned before about sort of upskilling community and giving them resources they need. Key to this is our academic partner social machines. So they'll be supporting the partners throughout the 3 years and developing key skills with them that will help them work with public health teams, but also with the wider sector, so that they can carry on this work past the programme. So social machines will be supporting in training in community-based approaches and providing resources and support for focus groups, as this is a new skill for a lot of the organisations, networking opportunities to foster collaboration, development of evaluation tools, including baseline measures. So this means that when we sort of have a focus group or a health inequality project, we can really clearly say, this is what our goal was at the start of this is the start point, and this is the end point, sort of highlighting sort of the benefit of these community projects and sort of their effectiveness. And then again, evaluating the effectiveness of the work within the programme, and then upskilling of our partner organisations. And then now sort of on to introducing our partners. It's just a short overview because we only have an hour today. We could talk for ages on sort of our 17 different communities. So within the programme, we're working with 17 communities with 14 organisations. The communities that we are working with were chosen based on the 2021 census data and the community health profiles to ensure that the programme was representative of the demographics and the health needs within the city. The communities have been divided across communities of faith, disability, LGBTQ+, and ethnicity. As mentioned, they'll be supported by our academic partner. So our faith, disability, and LGBTQ community partners. So our faith communities are being led by Flo Hobbs. So Lifeline Community Projects are our partner for both the Sikh and the Christian engagement partners. Our Christian engagement partners also includes Black and South Asian churches. Ashiana Community Project will be the Muslim engagement partner. For communities of disability, our lead within BCC is Ellie Jarasek. And our deaf and hearing loss partner is BID Services, and then Focus Birmingham is our partner for sight loss and complex disabilities. And finally, for Birmingham, for the LGBTQ partner, our lead at BCC is Alex Robinson, and they have 2 communities, so the LGB plus community and the trans plus. Our community of ethnicity partners, so we have 9 ethnicity partners within the programme. So leading on from Black here, our lead is Jordan Francis. So we have the African Deep Engagement Partner led by Alira Health. The African Deep Engagement Partner is also looking specifically at the Nigerian, Ghanaian, and Eritrean communities. Mind's Eye Development is leading on the Caribbean work. And then finally, the Allies Network is our lead for the Somali Deep Engagement Partner. Our South Asian communities, I'm leading on these ones. So our Pakistani Deep Engagement Partner is the Delicate Mind. Taraki Wellbeing is our Indian Deep Engagement Partner. And then finally, Legacy West Midlands is our Bangladeshi partner. And for our other ethnic communities, this is being led by Alice Spearing. So we have the Chinese Community Centre for our Chinese Deep Engagement partner, Centrala for our Polish, and for People for People for our Romanian partner. So it's a very short overview of who our partners are. If you do want to learn anything more about our partners, one of the first things that we asked them to do was to film a short introductory video, which sort of introduces the organisations, an overview of the community, an introduction to the project representatives. So on the screen, you can see the lovely Tundi and Anjola from Ilera Health. And they also discuss their key project priorities and contact information. So I can see the links in the chat, so please go have a look at that, so you can just learn more about our partners. Also in the descriptions of each video is a link to their websites, so you can sort of stay up to date with them and the work that they're doing over the next 3 years. So it's important to be able to see the work that's being completed, and visibility is key to ensuring that we can continue work like this in the future. So we'll go through sort of the key outputs within the programme that you'll sort of be able to get involved with. So first things first, our Health and Wellbeing Board. The Deep Engagement Partner Programme will have direct impact on the ambitions set out within the Joint and Health and Wellbeing Board strategy, with the programme outputs directly being linked into our newly established communities of identity partnership with representation from key decision makers. The purpose of the partnership is to work across communities' identity to address health inequalities across Birmingham, and to empower community partners to lead community-based programmes with support from the wider system to improve health and ensure community voices are shaping public health. The findings from focus groups and health inequality projects will influence the agendas of various Health and Wellbeing Board partnerships, and the involvement with the Health and Wellbeing Board will help link the Deep Engagement Partner work with the wider system, including the NHS, to improve health inequalities, not just exclusively within public health. And just on the slide, you'll see sort of an overview of the partnership. So it'll be embedding the teachings from Black Ear and building capacity, and then building connections between communities, sort of really highlighting the benefits of intersectionality. We know that people don't belong to just one community of identity, there is crossover. So it's a great way that we're able to sort of work with different partners to make sure that that intersectionality is highlighted. Next is our currently being developed community engagement toolkit. So the toolkit will contain guidance on sort of methods for community engagement, engaging with different community identity, and then an evidence-based approach for best practice. It's currently in the early stages of development, but we want to refine on key methods for engaging with communities to ensure that we have effective models that we can use not just in public health, but within the wider system. So we'll be developing case studies from the programme and then just building on a larger evidence base. So it's not just for public health, it can be used wider if you're doing any sort of community engagement work. We'll also be developing a Birmingham community stakeholder map, so it will highlight community organisations within Birmingham, the areas within the city that they operate within, and their core focuses. It'll be interactive and accessible, held on the BCC website, so you can access it anytime. The Deep Engagement Partners will map the stakeholders within their community, which will help ensure that the map to be as representative as possible with Birmingham's population. And it'll be able to support organisations to identify key stakeholders and ensure that there is sort of a wide breadth of the community being engaged. So we're not just engaging with the same people over and over, we're making sure that we're reaching sort of the full scope of sort of Birmingham's communities. So that will be available sort of in the future. Our health education campaigns toolkit. So the toolkit will contain guidance on various methods for developing culturally competent health education campaigns using an evidence-based approach for best practice. It originally stems from the recommendations from the Black Ear report, sort of linking into sort of health checks and campaigns. So we'll be using an understanding of communities' identity to develop traditional health campaigns to sort of include a cultural competency lens. So if you were doing a stop smoking campaign, you wanted to work with a specific community, what would you need to know to sort of tailor it to make it the most effective? It's been co-developed with the Deep Engagement Partners and communities of focus. So the guides, the community communication guide sort of includes languages and methods of communication, health literacy and cultural values, sort of key dates and community events. So we've got Ramadan coming up, and sort of making sure that if you wanted to launch a big campaign, you would have the knowledge sort of the community is going to be focusing on Ramadan, so we wouldn't want to sort of launch it then. It's sort of key things like that that would make a campaign even more effective. So that will be launching in the future as well. And finally, our cultural intelligence training. So we've obviously mentioned before, the partners will be developing 4 cultural intelligence sessions per year, and there'll be a mix of online and in-person sessions available to healthcare and wider sector organisations. And it's focused on developing a basic understanding of community use practice, key considerations and barriers that they may face. And this is linked to the work that's currently being done sort of within BCC and our partner organisations under the Birmingham Cultural Intelligence Framework pilot. So we've got a few sessions available at the moment. So we have our trans and non-binary awareness training coming out, our LGBTQ plus awareness training, and our African communities cultural competency training. And we'll have more of this over the year. I think I calculated it the other day that we'll have nearly 60 sessions per year. The best way to stay updated on this is to follow the BCC Public Health Eventbrite. So most of our events will be hosted on there, or following the specific providers training. So I know that Birmingham LGBT hosts their own training on their Eventbrite platform. So if you are interested, please stay up to date because they are going to be really great. And then finally, our focus groups. So each provider will be doing 4 focus groups per year. And we currently have quite a few in development. So they're looking at sort of healthy lifestyles, so barriers to physical activity, healthy eating, women's health. So that includes maternity, FGM, and general health and wellbeing, and then mental health and self-care. And we're always sort of open for collaboration. So if you are working on something that you think would be great to sort of collaborate on a focus group with a specific community, we do have a focus group request form that will go into the chat. So if you want to reach out with us, we can have a look and see if it's something that we can work on with our partners. And we're keen to sort of be able to share our findings as much as possible. So if you are looking to sort of attending a focus group for a community that you are part of, please stay up to date on our social media to find out more information for relevant focus groups. They'll cover a wide range of demographics within the community to ensure that we're accurately capturing views within a group. And then just sort of a case study of sort of the benefits of this work already. And this is through the lens of the focus group. So this is from Alira Health, our African Deep Engagement partner. So they collaborated with our health protection team within BCC to shape focus groups questions, or focus group discussion. The responses then fed into existing community vaccine projects, and that meant that the organisation was able to receive additional funding secured from NHS immunisation, the vaccinations team, which has led to a collaborative project with the community to create a culturally appropriate vaccination campaign. And it meant that community resources and campaign materials are then available for repeated use. So the sort of benefits of working with the Deep Engagement Partner Programme means that it avoids a lengthy process for initial project approvals, quicker turnaround for community insight, and the community then gets to see sort of outputs of discussion in a short time frame. One of the things that we're very keen to do is to be able to sort of go back to the community and say, you've now attended this focus group, this is now the work we've been able to do, and sort of be able to show the progress we've made really entices people to come back and be able to sort of engage with us, rather than us saying, okay, thanks for that focus group, we're going to keep this information and not share it. So it's really great for us to be able to sort of go back and say, this is now what's been achieved. And it also means that we create culturally appropriate campaigns and project outputs. So I know I've mentioned about sort of staying in contact with us to sort of keep up to date with this programme. 3 years can go really quickly, but we don't want you to miss out on any of it. So we have our Healthy Brum social media handles on Twitter, Facebook, Instagram and YouTube. We have the communities team inbox. So if you have any questions, please email the inbox. Also, my email is available as well, so please contact me if you have any questions. I'm also trying to get really good at LinkedIn because it is a great place. So myself and Jordan have our LinkedIn contacts available. Jordan specifically for the Black History, and myself for the South Asian work and just the general project overall. So I think that's it. So I know we've had a couple of questions come into the chat. We just want to sort of suggest some discussion ideas. So any other resources or information that may be of use or any opportunities for collaboration. Because we got to the end of the slides, I will end the recording just in case anyone wants to come on. But any questions,